Hi, Dr. Lindsey here. In this video, I'm going to cover some just selected topics in kind of malfeasance in hair transplant. I get pictures that are sent to me, and I take pictures and I keep them on my desk to show potential patients. And the desktop's getting fuller, so I'm going to accumulate these into one reasonably short video. So here's an example of a poor guy who's had thousands of FUEs on his head, and it has nothing to show for it. He's about a 40-year-old, I think, Special Forces fellow who has gone to a variety of places to get FUE, and here's his results. He told me he's paid for 8,000 grafts. I don't know whether that's true or not. It certainly occurred over a number of years, but 8,000 is a lot of grafts. That's 2.5 big strip cases, and in general that should cover the whole top of a class 5.5, maybe 6 head reasonably well if done properly. And so here's his results. I had to be careful not to get his face, but that looks like 12 to 1,500 grafts. And so he comes in asking what I can do for him. And so let's look at this donor area, and you look at the donor area, and there's isn't any hair left there. I mean, there's enough hair that he does not look scarred, but if he had longer hair, he'd look like a mangy dog. There's simply complete swaths that don't have any more hair coming out of them. And so he could probably be salvaged some with a strip, but now he's forced to wear a crew cut, not because of the military, but because if he grows his hair out, it's so depleted it'll look odd. And so I had to tell him I had nothing to offer him. He could consider SMP, but that is, I feel for the dude. He's a big, muscly guy, he's protecting the country. He sought out medical attention from a variety of people who all, according to him, told him that sure they could cover everything with 1 or 2 cases of FUE, and now 6 cases into it, or whatever he said, he's essentially a hair cripple. I mean, what are you going to do? Similarly, here's another military guy. I haven't seen him for a number of years, and in fact, I offered to. He is repairable. He's still got plenty of hair back here, but he also told me he had paid for 6,000 FUEs from the same doctor, and he'd gone back 4 times, and here's his results. So I would submit to you, I can see going back to the same doctor to get repaired. Nobody gets them all right. We statistically do 3 touch-up or repair cases of our own cases per year, and we do about 200 cases. Those are reasonably good odds. But if you go back and, if nothing grew, and then you go back and get a second case and not much grew, I'm not sure why you'd go back a 3rd or 4th time. Even if it was free, and according to this man, it wasn't free. You had to keep paying each time you went. And so I did offer to fix him, and I offered to do it very inexpensively, just for the costs, as long as I could use his case as an illustration. And he declined. He had signed some paper with the other doctor that said that he couldn't go anyplace else. So 2 military guys, both defrauded, and I think they could have prevented that if they simply investigated and made a better decision prior to committing to a surgery. This is a lady, she's about my age, Indian lady, who came to see me 3 or 4 years ago about doing a hair transplant on the front of her head. And she had an autoimmune condition that really, although it was stable, I explained to her there was a high likelihood that it could recur at some point in her life and cause the hair transplant to become unsuccessful. And so she insisted that I go ahead and do the surgery. And the more we talked, the more I thought she probably was not, we probably just weren't matched up well. And so we ultimately did not do her surgery. And she came back in this past week, it's been 3.5 years, to see whether I would do her eyebrows. And I pulled out her chart, and I said, gosh, you've got some hair where you didn't have it before, and you've got unusual looking eyebrows. And she said that she had gone to Turkey. Now, mind you, it could have happened in Turkey, it could happen in McLean, Virginia. Somebody operated on that head, and she said she told me how many grafts she thought she paid for, but here's her recipient area in the front of her head 3 years out from a hair transplant. And that just ain't much hair. And here's a frontal view. She is salvageable with some Topic, the powder that sticks to your hair. And if she did not have the autoimmune condition, or if we both knew that it wasn't going to reoccur, we could definitely improve that with a relatively small case. And I offered to do that for her. However, I couldn't guarantee her that those hairs would last the long term. We're about the same age. Different environmental or stress factors or health factors could cause her autoimmune disease to flare up next week or 4 years from now and cause the hair to fall out. And she essentially said if I couldn't promise her it was going to last the rest of her life, we wouldn't do it. And so we didn't do it. But I think if you're going to do it, she should have gotten a little better case than that. And she's quite unhappy with the way her hairline is. But sometimes when you have a medical condition, maybe you're just not destined to have a hair transplant. Okay, here's a few guys with extreme cases of donor depletion. One or two of the pictures were emailed to me by the patient. One I got from my friend, Dr. Bloxham. The other ones have come here. And look at the back of this guy's head. This is years out from a hair transplant. I mean, how do you camouflage it? If you shave the whole head, it ain't gonna look right, and you've defeated the purpose of having a hair transplant. And if you let it grow, oh my gosh, it looks like a checkerboard almost. This guy's even worse. I mean, there's just no hair left in the recipient. It's almost like it was shaved for this picture, but unfortunately it wasn't. And in fact, I just went skiing in Utah 2 weeks ago, and I probably saw 3 or 4 people at Dulles Airport and 2 or 3 up on at the lunchroom in the ski area who were guys demographically looking like me who had a little bit of hair in the front third of their head and mostly depleted donor regions. And I'm always wonder whether they're happy, because in the mirror they can see they have somewhere where they didn't have anything before and they don't see back here. And I wonder how that affects their life. I think it would be a big problem if it was our customers. People would be showing up here with pitchforks. Here's 2 more donor depletions. It's just horrible. People need to be shown examples of what the doctor has done. Nobody gets them all right, but the doctor should really talk with the patient about the risks and benefits and what the average case is and what the best case and kind of what the worst case could be. Here's a young man. He's a 30-year-old fellow that came to see me in 2015. And I told him he was going to need 2 big cases. And he's got average hair, good color contrast. And I think I quoted him 2,500 grafts. I looked back at his chart for his first case. And he went to a fellow I know who dabbles in hair and said he got 1,500 grafts in a little less than 2 hours by strip. And he said that didn't really work well. And so he went back and had a second case done, which he says the doctor told him was 2,500 grafts. Again, it only took, according to the patient, about 3 hours to do. And then he said it still wasn't satisfactory, so he went to another local clinic and said he had 2,000 FUEs twice. So now he says he's had somewhere around 4,000 to 4,500 grafts by strip and another 4,000 by FUE. And he's in the healthcare field and has a break from his work at this point. So I said, I think you're salvageable. He's currently wearing a comb over, which does conceal his hair loss, like a lot of guys do. But when you pull it back, there's just no hair there. There's no evidence of 8,000 grafts. So now his donor area has 2 linear scars and a zillion little white marks that still have hairs protruding from them, meaning that the doctor did the FUE and probably was not able to get the root, yet they planted. In fact, he said the doctor wasn't there, so I have an idea of where the clinic was. But again, if you're going to do a hair transplant, make sure you see a doctor. At least in the state of Virginia, a doctor is supposed to do everything that involves transecting the skin, or a physician's assistant, not a technician. And if you have something like that, feel free to report it to the Board of Medicine. That's what they're there for. But he's now low on money and low on hair, and what do you do? And just starting his health career for the next 30 years. So again, this could have all likely been avoided with not doing something that sounds going to be super easy, but rather doing the right thing initially. Or not doing anything at all. I mean, nobody needs to have a hair transplant. And I would submit this fellow and maybe a couple of others that I'm showing in this video. Might have been better not to do anything. You don't have to do elective surgery, elective cosmetic surgery. Lastly, here's a fellow that was referred to me by a dermatologist who does some hair in our area. And so the guy came in, and so his story is he went to Abu Dhabi for his first hair transplant a number of years ago. He simply said it wasn't enough hair. And so he went back to Jordan and had this done. And mind you, I'm not bad-mouthing any other country. This could easily happen in the Commonwealth of Virginia. But his story is he went to Jordan, had a lot of FUEs. I can't remember what he told me. I think he said 2,500 or so. And he got on the airplane to come home, and he said that his head was hurting, and so he talked with the doctor by the phone, and the doctor said, take some antibiotics. And it continued to get worse. And this fellow's story is that after a day or two, he was no longer able to contact the clinic. They wouldn't take his calls or anything like that. So he gets back and gets admitted to the hospital with osteomyelitis of the skull bone. And this is a month or two before I get a hold of him. And then he saw a dermatologist who I guess is treating with antibiotics, and I'm not sure what exactly they're going to do, but he came out to see me, and this is now 3.5 months out from a hair transplant. And that is no longer an active infection. It's just a dead wound that's now healing in by secondary intention. And what that means in non-doctor terms is that if you have a hole anywhere that is dead tissue, eventually the body will heal it in circumferentially from the edges on in. It just takes a long time, and it's facilitated by a variety of things, including peeling off the scab every day. There's different people who will favor hyperbaric oxygen, but in general, I used to do head and neck cancer reconstruction. These things all heal. They're slower if you're diabetic or slower if you smoke. He's a smoker, but eventually it'll heal in, and he'll most likely have a patch right here, probably the size of a 50-cent piece, that just doesn't have any hair. And I told him, he wanted to get it fixed tomorrow, but you got to let this whole process come to its rightful end, and then wait a year or so until the soil that you're going to plant in recovers, and then you can put hair in that. And we've got one or two videos showing guys like that, and a bunch of videos, including one I just shot yesterday of putting hair in scar. It tends to work pretty well, but you got to let the process go to its conclusion. And the problem is now, whoever the patient is running around with this funny looking bald spot, and they're anxious to do it again prematurely. And if you don't kind of follow the rules and let things go to their rightful healing time, you're going to get another bad event. So this was just kind of a random video. There's things that have popped up on my computer that I was wanting to do individual videos on, but none of them are good enough or big enough to do individual videos. So the main thing of this is do your research before you sign up for surgery. Look at pictures or videos that your doctor has done, and have an in-person consultation, and look at results that are similar starting points to where you are before you proceed. If we can help you, give us a call. Thank you.